Welcome, everyone, and thank you for joining Amethyst at Penn's October 2024 seminar. We are proud to offer this content through our Amethyst at Penn Hub. Amethyst stands for Achieving Maternal Equity and Transforming Health Through Implementation Science and Training, for anyone who may not know. Funding for this hub comes from the NIH's Improve initiative, which aims to reduce maternal mortality, improve pregnancy, perinatal, and postpartum care, and to address the factors that have led to severe disparities in outcomes for marginalized groups. As a reminder, we will be recording this discussion and it will be available on our YouTube channel for review after the session. Please feel free to put any questions in the chat and we will have time for additional questions and Q&A at the end. This month, we are fortunate to have Ms. Debora Grandison here with us to speak about patient storytelling in healthcare. This is a part 2 to her September seminar, which can be found on our YouTube channel. Debora is an author, poet, inspirational speaker, health advocate, and a wonderful member of our Amethyst team as our patient co-investigator. So we're so fortunate to have her here with us today. And with that, I will turn it over to you.
Thank you so much, Casey. It is such a pleasure to be with you all again. And as I mentioned in the chat, I'm going to be off camera while I'm presenting, and we'll return with you during our Q&A session. So I just thank you for your grace this morning. I'm sorry, good afternoon. It's still morning where I'm at. Well, I want to again thank you and welcome you back to the Connecting, Collaborating, and Contributing for Change, Part 2. Again, I am Debora Grandison, and I am a 35-year heart disease and diabetes survivor. And as I always introduce myself, someone with a pacemaker, an insulin pump, and a purpose. So in Part 1, we discussed some of the barriers of healthcare, the barriers of communication when it comes to healthcare. And we discussed how powerful of a tool storytelling is in healthcare. We also covered where storytelling can make its greatest impact. When we share our stories, we create opportunities for better dialogue and communication between patients and providers. When we share our stories, we're sharing lived experiences that help to educate, spread awareness, and promote the benefits of advocacy. When we share our stories, our experiences assist researchers in the development of more effective research practices, improve medications, procedures, and devices, which will improve the quality of care available to us in the future. And when we share our stories to policymakers, we are giving the policies that we are striving to change a face. We are humanizing the issue and giving the policymakers a reason to care about what we're advocating for. Stories produce empathy and have the ability to create an emotional connection between the patient and the audience that they are sharing their stories with. The listener will gain a deeper understanding for what the storyteller has to share. Today, we'll be discussing the barriers of communication that occur between patients and providers. And as we look at the various barriers, I will be sharing a few of my personal experiences in hopes of highlighting a patient's emotions and perspectives, and how those experiences can lead to the walls of mistrust and miscommunication. I always begin by saying that it's impossible for me to share a 35-year journey in 35 or 40 minutes. But my hope is that as we have these conversations, this will continue to open doors to more dialogue, more brainstorming, and more collaboration for change. The barriers that we're going to discuss are trust, language, cultural barriers, medical terminology and lack of understanding of health-related topics, stigma and bias, and limited time with medical providers. We're going to begin with trust. There are a number of factors and experiences that lead to a patient's lack of trust in their providers. Each of the communication barriers mentioned above lead to building a wall of mistrust. When a patient feels as if they're not being heard, and that their fears are not being addressed, or their concerns aren't important and haven't been resolved, they leave feeling misunderstood and misinformed. While I was experiencing multiple unexplained symptoms as I was prescribed medications to mask each symptom, I went through several invasive and non-invasive procedures, tests, all resulting in being sent home with no clear answers or resolution. One doctor told me that the severe palpitations I was experiencing were simply due to anxiety, and she prescribed Prozac and Xanax and sent me on my way. Because this physician had already placed me on 13 other medications, all to try to alleviate the symptoms, it really caused me to not have a feeling of trust with her. And I didn't feel that she had my best interests at heart or that she was steering me in the right direction. So I decided on my own not to take those anxiety medications. Family members and friends that were in the medical profession recommended that I find another doctor. And in my heart, I knew that I needed to do so, but I didn't know who to trust. Who was I going to have to assist me with my medical care? I had been shuffled through many medical groups in search of cardiac care, and some of my doctors would tell me that my rhythm was off when they'd listened to my heart, but they weren't able to pinpoint what was actually causing it. I became so discouraged by the lack of information and direction that I received from my doctors, and many made me feel as if the symptoms I was experiencing were all in my head. I barely trusted myself to know if what I was feeling was real. Unfortunately, there are many examples of disheartening experiences I've had over the years, and they all serve a purpose and stand to help others to find themselves when they're struggling to advocate for their own needs as well as the needs of their loved ones. It took years for me to establish a strong connection with my medical team. The search was exhausting, but I'm grateful that I have a great cardiac team that I'm currently working with. Because of the challenges that I previously faced, I'm now more confident when asking questions about my health needs. And I want to use what I went through as teachable moments when presenting to others. I see my current team of medical professionals that have my best interests at heart. And I see them as those who are engaged and listening with me and to me and want to see me thrive. We're going to address language now. Language, when the walls go up, when a patient and provider has a difficult time communicating because of a language barrier, it's difficult to establish a rapport when patients and providers struggle to understand each other. When language is a barrier, it can lead to misunderstandings of medical history, medication errors, and unnecessary testing and treatments. Patients who struggle to communicate with their provider because of a language barrier may also have limited access to health care, the services that they need and that they deserve. Some patients may have family members that will attend medical visits with them. The challenge with that may be that the family member may misinterpret what the provider needs to relay to the patient, which could lead to the patient not receiving an accurate assessment. And limited communication leads to limited care. Language barriers make it difficult for the patient to communicate and understand how to advocate for themselves. Hospitals and clinics that have interpreters and translators on staff can assist with the communication process. And offering continuing education opportunities for staff to learn strategies to improve in patient communication skills. Next, we're going to talk about cultural barriers. Different cultures have different beliefs, perspectives, and practices, and they also have different faiths. Some people's faith prohibits them from receiving blood transfusions, and some do not believe in the life-saving surgeries or using certain types of medical devices or wound dressings. Cultural barriers in healthcare often hinder patients from receiving the medical attention that they need and deserve. I witnessed friends who practiced a particular faith lose a child because the child needed a blood transfusion and they refused the procedure. Cultural differences help to determine the foods we eat, how we spend our time, our money, how we choose to move our bodies or limit our activities, how we shop for our foods, what we listen to, and how we are impacted by our generational foundations. Offering continuing education opportunities to staff to learn strategies in order to bridge the gap of understanding the needs of the people who come from different cultures would be a benefit to everyone. Excuse me. Next, we're going to talk about medical terminology and lack of understanding of health-related topics. When patients struggle to understand medical jargon and terminology, a diagnosis, test results, or an unfamiliar medication, it sets the stage for confusion, misunderstandings, and mistrust. And when a patient is given a diagnosis or lab results with no detailed information, follow-up, or instruction, it makes the next steps challenging for the patient to understand and accept. I recall after speaking to a group on awareness and prevention of heart disease, an attendee from the audience shared that she had recently been seen by her doctor. That doctor had informed her that her recent EKG results were abnormal. She looked at me with great concern and asked me, "What does having an abnormal EKG mean?" I felt for her because I was her. I often left appointments feeling discouraged, wondering what to do and who to turn to for answers. I often left appointments feeling guilty, chastised, uneducated, and incapable of making wise choices for my own health. I had an internist tell me that because I had 3 chronic health issues, those being heart disease, diabetes, and Graves' disease, I would probably become depressed. So he wrote a prescription for antidepressants. I refused that medication. I told him I didn't need it. But I have to tell you, I do understand after going through a lot of the things that I went through, how difficult it becomes for a patient to navigate through having a health challenge, trying to raise a family, have a career, and manage their own health. I can see how mental health is definitely impacted by these things. Another physician I had told me that he wanted to increase a dosage of my heart medication. And when I asked him why, he said, "Because I said so." I wrote a letter to the head of his medical practice, and he came back with an apology for his behavior. During my first pregnancy, the doctor told me that I needed to stop eating anything that contained sugar because if I didn't, my baby would die. I asked for more information on what was wrong and how I should eat because there's sugar in almost everything. He ended our visit by saying he'd see me in a couple of weeks. I left his office frightened, discouraged, and confused. And I went home to do my best to change how I ate. And I prayed that my baby would be all right. The doctor that placed me on those 13 different meds I mentioned earlier was clearly.
Okay, perfect. Yeah, I just wanted to reschedule my appointment on
Hi,
Monday.
Sing. I don't think you are on mute. Thank you.
Oh, all righty. The doctor that had placed me on those 13 different medications was clearly treating every symptom I had, searching for the root cause for the symptoms had never been a part of our conversation. I had given up on my real estate career. I spent 4 months in bed. I had no energy to fight for my care, and I was feeling hopeless. I just wanted to be well again, and I could not envision my future. It was during this time that I lost my father, my uncle, and my brother to diabetic related heart issues. I convinced myself that I would suffer that same fate. I knew that I couldn't remain in that state of fear and grief. So I used all of my energy and I left to find answers. I could not just sit and wait to die. I had to fight to live. So I enrolled myself in a cardiac program and I researched information on insulin pumps to gain control of my glucose levels. Assigning an advocate, a staff member, or volunteer who can follow up with the patients and offer them some assurance when they have concerns about their health care would be a very valuable tool if we can put that into place in some of our clinics and our hospitals. Having a follow-up plan can close the gap of misunderstandings and miscommunication between the patient and their care team. Next, going to cover the stigma and bias barrier. When patients are seen and treated differently because of their physical, mental, or emotional health, living with a chronic condition, a disability, a mental or emotional disorder, weight, skin color, age, or cultural background can put patients in a space of feeling shame and guilt. They may become depressed and may isolate themselves. They may refuse to communicate with others and may refuse needed medical care and treatment. When there's no communication, it opens the door to the patient filling in the blanks, guessing what their symptoms are stemming from, questioning their own judgment, and diagnosing themselves. Following my gestational diabetes diagnosis, my blood glucose levels returned to a normal range for about a year and a half. I was facing dangerously high numbers after that year. My levels rose to 683, and I was told that I shouldn't be sitting up and able to have a conversation with numbers like that. I was then placed on insulin shots and was labeled as a lean diabetic because I was thin at the time. I was also told that I would likely see an increase in my weight because of the insulin that I was taking. That held true. I experienced an increase in my weight as well as my blood glucose levels. They also began to rise. I was in search for an endocrinologist to help me manage my new insulin-dependent lifestyle. The specialist that I found told me that my numbers would improve if I would simply just push myself away from the table and eat a healthier diet. Why should I change? This was what the doctor said. Why do I need to help you change when most diabetics aren't even willing to change their lifestyle? They continue to eat what they want and do what they want. That conversation was less than motivating for me, and I really didn't trust much that this doctor had to say. I read his attitude and demeanor early on, and I felt he truly could care less about me achieving any success with my health needs. I was being defined by my diabetes diagnosis and by my struggle with my weight. At first, I fell prey to the guilt and shame that was being thrown at me. But I finally realized that it was up to me to bring about the changes I desired to see. So I signed up for a diabetic education and nutrition program and enrolled in several weight management classes over the years. Now we're going to move to disparities. I created this graphic because I looked at what the word disparity means, and you can see it has a number of things. We look at contrasts, diversity, unlikeness. And so at the bottom, I felt like I wanted to share that disparities may define how a patient is seen by their provider, but it also may describe how that patient feels they are seen, which to me plays a role in finding trust and being able to communicate with the provider on our own needs. All right, so then we can move to the next slide. Black women are 3 times more likely to die from pregnancy-related complications than white women. The variation in quality of healthcare, underlying chronic health conditions, and structural racism contribute to these disparities. I've been blessed to have access to quality healthcare, especially while navigating through these 20 years of misdiagnoses. But during my first marriage and first pregnancy, I experienced the other side of the coin. I was going through a separation, which eventually led to a divorce, and I had limited access to quality care. I've had to go to clinics that were for underserved, and I just became a number in the system. I would sit for hours in clinics waiting to be seen. I was herded through appointments like cattle. And when I had valid questions, I was instructed to hold my questions for my next visit. It was one of those clinics where the doctor told me not to eat sugar or my baby would die. Weeks later, I had questions about my due date, and I went in for an ultrasound. When I asked if everything looked normal, I was told yes, everything was fine, and there was nothing for me that caused alarm. The very next morning, I was rushed to the hospital in labor and delivered a premature baby. Work to have an open dialogue with patients in attempt to build stronger lines of communication with the patients. Trust can be built when the patient sees their needs matter to their provider. And then we're going to talk about limited time with the medical provider. Surveys show that the amount of time that providers have with their patients is between 16 and 24 minutes. The time the provider spends with patients is critical for establishing good lines of communication. Many providers are facing overwhelming patient caseloads, which lessens the time they have to spend with their patients. I do understand this also causes, a lot of impatience for the doctors. They're placed in this position. When a patient has been given difficult or challenging news, being rushed out the door with no time to process the news and or treatments sets the stage for the patient to mistrust the provider and potentially disregard the provider's expertise. Some patients won't ask questions or seek additional information and may not be open to treatment and the plan that the provider offers. The barriers of communication between providers and patients can lead to patients refusing care, not seeking care, building walls that will eventually lead to the patient suffering and potentially dying from preventable illnesses and complications. Understanding these barriers and developing strategies to close the gaps when having open dialogue and improved patient and provider communication is what connecting, collaborating, and contributing to change is all about. Thank you so much for your time and attention, and thank you for all of the great work that you are doing to bring about change. And we have a couple of additional links that are here for you, how poor communication exacerbates health inequities and what to do about it. And then also racial justice in maternal health, how to reduce Black maternal mortality. Thanks again so much.
Ms. Debora, thank you so much for sharing your wisdom with us, your experience, and especially as your allergies are giving you trouble. We really appreciate we're taxing your voice. So for those of you who have not met, I'm Megan Lane Fall. I'm one of the co-leads of Amethyst with Dr. Rebecca Ham, and I'm going to moderate our question and answer session here. Feel free to put your questions in the chat. I will start with a question. We got a pre-submitted question that had something to do with time and how you manage your time. And certainly that's going to depend on sort of what your role is, but I'm wondering if you can talk us through how long does it take to put together a story? If someone asks you to do a speaking engagement, how do you think about setting that up? What's your process? Just to kind of give us a little bit of insight under the hood.
Okay. So, in our last segment when we talked, I talked about meeting people where they are. So it depends on what the audience is seeking. Sometimes they just want strictly, okay, we want you to share a little bit about your story, but we want you to really focus in on the preventative tools and measures of, eating right and all of that. So I just want to say in every case, I'm always going to begin with a little bit of a personal story because it's important, but I may be focused or sent to talk about specific things. Maybe it's AFib, maybe which I have as well. Maybe it is the correlation between diabetes and heart disease. So I have a standard, you know, telling the story 35 years, 20 years to misdiagnose that I always, put into the project or the presentation. But it really does depend on what I've been asked to bring forth. And so it kind of, gets crafted because, depending on what they're looking for, if that makes sense.
It does make sense. How do you get to know an audience so that you have a better sense of which parts of your story are going to resonate with them, which parts you might want to spotlight foreground as opposed to keep in the background?
Excuse me. Okay, so that's because I think it's really important to try to have a little bit of time ahead to network, to come in, maybe kind of, I like to work the room, talking to people, finding out, like, okay, what brings you here today? Or, are you, part of this medical team, or are you a patient? Or, do you work for an organization that's looking for, so you're listening. I feel like I'm a good listener. So I'm listening to what I'm hearing from the group, and then it helps me to kind of throw in specific things that I think will be beneficial to someone that's in the audience.
Can you think about a curveball you've been thrown as you have told your story, where maybe you had to, it wasn't exactly the audience you were expecting, or you got a response that was unexpected? How do you what's come up? The stories from the field.
So I don't know why this one came to mind, but I did something for a huge company here. They were doing a lunch and learn a number of years ago. And so again, it was really centered around my own personal story and then adding a lot of the tools of advocacy. And so I decided that I would create a survey. I like to do that. I feel like that's the way you engage with people, is find out, what was the impact that this made on you, and how will this help you steer how you look at your care and all that kind of thing. So I had done this survey, and at the bottom of it, and this is a key point too, as a presenter, as a speaker, for me, it's imperative that I get a critique, meaning I always want to improve. There's always room for improvement. Hearing from the audience and knowing if I hit the mark with them or I miss the mark, that helps me for the next time. So in this particular case, I had asked the group to, a couple of questions about, what they learned or if they learned anything or whatever. And I got some great feedback. There were probably 50 people in the room. And I got number 1 out of 50 said that I didn't know what I was talking about. Yeah, I was, my story wasn't helpful and that kind of
Oh
thing.
Lord.
And And it really threw me off because number one, I was like, well, now I'm the only one that knows the story. So, but I say that to say that was one that threw me off, and I didn't know how to take that. But I do know that we're always going to be, there's always going to be someone that's going to kind of challenge your, I guess, level of expertise, or I don't know. I'm not really sure where that came from. But for the most part, I've always had really good feedback, good questions. I think the woman that I mentioned earlier, that threw me a little bit because I wasn't expecting for her to come to me and ask me specifically how to help her. And
Right.
of course, I always give a disclaimer. I am speaking to you, from lived experience. I cannot give you any kind of medical, advice. But of course, I strongly advised that she reach out to her physician as soon as possible so that she could gain a level of comfort in what she was told and then know what the next moves needed to be so that she could get the care she deserved.
That makes a lot of sense. It's wild that you had that reaction. Especially because you're clearly an expert in your own story. So for someone to question that is very, very strange to me.
Yeah, it was different.
But I'm glad you shared it. Um, Along the lines of feedback, how do you process the good and the bad? Because I think, especially being mindful of our partners across the Improve Network, thinking about how they're going to be working with folks to tell their story. There's the good part of the empowerment, the sort of inspiration, and all of that. But then there's the bittersweet, like maybe someone doesn't hear it the way that you want them to hear it. Maybe you get 90 positive comments and one kind of knucklehead comment. Like, how do you equip people to sort of take the good with the bad, get them ready for that?
I think obviously you have to go in prepared for something like that. Like you have to almost expect it. And so, because we know that, there's always going to be someone who is going to, I'm not trying to say that there's a lot of negativity out there, but in a sense, there is when it comes to, hearing people's stories. There may be some disbelief. I've found people to be in disbelief when I've shared some of the things I've been through. Like, there's no way, Um, but it's doing your homework and knowing that uh, you don't want to throw something out there that you're not, how can I put that? You don't have any expertise on. Like I can't come in here and start spewing a lot of things about, uh, stats or whatever in the healthcare arena in another state, or I don't know if I'm making any sense. It's like you got to know, you got to stick to your story. And it's, of course, if you're telling your own story, obviously nobody else is going to know it like you know it, and they're not going to tell it like you tell it. And we just have to prepare ourselves that there are going to be people who are going to question, um, what they're being told. There's some people, don't believe that they need to go to the doctor, for checkups annually. And so when you go to an event and you're telling them, I want you to know your numbers, which I do all the time. I ask, do you know your numbers? Most people go, what? I don't know what you're even talking about. What does that mean? You know, so, just meeting people with grace and not making them feel like you're judging them because they don't know their numbers. You smile and you say, these are numbers that will really be beneficial to the care that you have. And also it's heart disease is 80% preventable. So if you're doing some of these things and looking at these particular numbers, it could really benefit you and it could keep you from having something happen down the road. So, just talking to them and giving, like I said, giving grace, um, meeting people where they are.
Yeah. How do you learn how to tell a story if you've not done it before? So everyone has a story, but sometimes putting it together in a way that's attractive, digestible, like compelling, where you've got people sort of hanging on your every word. That's a skill. So I'm reminded of when people think about negotiation, one tactic is to just try to negotiate everything. Even the tiniest little thing. You go to the grocery store and you say, "Can I have 5% off that?" Just to see what happens, right? Just to get used to
Right.
asking the question. So
Right.
what pointers would you give to folks who are trying to develop that storytelling muscle?
Well, my hope is that anyone who has been in a situation, they recognize that there's purpose in their story, or that their story, again, has an impact. It has to start there. If you doubt that what you've been through, that your experiences are just, like, oh, I'm destined to be hopeless or doomed. And I hear people say this kind of stuff. If you doubt that your story can make an impact, then it's going to be more difficult for you to craft the story so that it's going to be meaningful to someone else. For me, I just recognized that, or I went back in time and I thought about all of the fear, the anxiety, the times when I would sit and question what my future looked like. I was trying to be a good wife, a good mother, have a career. And I, literally was in bed for months at a time. I looked at all that and I thought, this doesn't make any sense. And I don't want anybody else to ever walk in these shoes, And that, for me, that helped me to want to craft a story. That helped me to want to be out there advocating for other people, because just I love people, and I hate to hear people going through things that really they don't have to, because some of this we don't have to experience. We're kind of thrust into it because of various reasons. But being able to say with confidence that there are ways and means to improve the quality of our care by learning as much as we can and telling other people, let me help you advocate for you. Let me show you, this is what I had to go through. It wasn't pretty in the beginning, but I really embrace that all the things that I experienced have helped me to see light at the end of the tunnel. And I believe that's what I really want other people to have. I want them to know that there is light at the end of the tunnel. And so that part of the storytelling, just maybe it comes naturally for me. And then I'm trying to be funny, but it's been a part of me for so long. And now working with Amethyst, it's also then explained or shown me, revealed to me would be a better word, just how powerful that is. I was out doing it. I was out passing out brochures. I was out telling people, listen, you don't have to stay in this space. You don't have to stay with a doctor who has caused you to feel less than. You don't have to stay in a clinic that you feel like nobody's hearing you. But those things came to now, okay, now I see the far greater impact, especially when you're able to collaborate with others who are like-minded, who want to achieve and accomplish the very same goals. Because it's like, if I go out in my backyard and I got a flashlight and I spread it over, I might have said this before, and you only see so much with that flashlight because you're out there with a single light. But when you bring other people in and everybody's got a flashlight, we expand our area and our
Absolutely.
focus and the impact.
Absolutely. So what I'm hearing you say is some of it is having a sense of the power of your own story, and that in some ways, a storyteller has to own first, right? You have to believe that it's worth telling. So there's a little bit of
Yes,
internal work there.
yes, you have to believe that you don't have to stay in that space. You have to know that, and you have to think about you did. What tools did you use to get to a different doctor? And I wanted to share this. I literally do you all remember? I don't know if they still have them. Those big books that you could get where you thumb through and it was doctor after doctor after
Oh, yeah.
doctor. I can't tell you how many times I sat, tears in my eyes, reading these names, knowing very limited information on these physicians, and wondering if I pick this person, are they going to be worse than this last one?
Oh, wow.
It was
Yeah,
it was a terrible experience, and I know I'm not the only one who has had that experience, and that's what makes me so passionate and keep fighting for others because I want them to get it and get what they need.
absolutely. So yeah, I think I agree. It would be great to see people realize the power of their own stories. At the same time, I think we all have to create that space to make it safe for folks to tell their stories. And as I think about the partnership between researchers, investigators, and folks that are telling a story from a patient perspective, that we have to create some safety to be able to do that. We
Yeah.
have a question from our friend and colleague Carl, who wants to know if you've told your story to legislators and if you can speak to the effects that stories have in that policy legislation world.
Yes, absolutely. And thank you for that question, Carl. Yes, I've had an opportunity, and I think I mentioned it last time, to go to my state capitol and lobby. And I've also gone to Washington, D.C. to lobby for more funding for women's research. A lot of the bills that we worked on here locally, were schools, smoking, different things, different bills that were needed to be passed. And so when you get to walk in and talk to your representatives, um, again, it brings that face. They're seeing these bills. It's just like another piece of paper. It's tossed into their office. Okay, they're supposed to review this. Okay, this is okay. But when you bring in a team of people who are living in those spaces and can say, I want to see change because I know that my children are now predisposed to these illnesses that I have been living with, and I want it better for them. I don't want them to have to stumble and walk through these things and try to figure it out. So you're putting a face to it. And so those are opportunities that were very beneficial. And it was great talking to some of these legislators. We might think they're way too busy, but they took the time to meet with us, listen to what we were saying, and we saw change. We saw things pass, get to, just, and I believe we were a part of that just because we were there. We showed up. We showed up to tell our stories. And I believe it made a great impact.
It's wonderful. One of the things as I think about our network is trying to figure out how to operationalize or how to make it easier for the folks that we're talking to put these principles into practice. How do you promote storytelling? How do you actually go out and find a partner? One of the questions that comes up for me is how many stories should be told? So sometimes you'll go talk to an audience and it's just you. And it's great. It's really compelling. You tell your story, but sometimes you want to go to a legislator. And I heard you say we, right? Like you go with a group of people. So if you were going to give advice to a research team or a community group, or how do they start to think about how many stories?
Well, okay, so I'm thinking in terms of if you have a group of individuals and they all have something different or something unique to their story, you want to bring them together because they can kind of navigate. There are different pathways, different vessels, different veins, right? So you got somebody who, again, someone who's living with AFib, someone who is living with diabetes and heart disease, someone who has had congestive heart failure, someone who had a cardiac went into cardiac arrest and was revived on the table. You have all these different variations of stories. It may all be about heart disease, but you've got different things. People are impacted in different ways. It reminds me of the fact that I felt like people were actually opening up a book when it came to my care. And it was like, well, patient number 245, when she was here, yeah, she had a little bit of what you were talking about. So we're going to treat you with that. And that we are unique. Our bodies are different. And a lot of times when we're feeling something or going through something, we know better because we're living it. And you can go in and tell the physician, I'm feeling this way. And they go, well, you wear a Holter monitor and we don't see it. So they brought me back to the textbook thing. So because of the uniqueness of people's stories, it's great to maybe have a group of people who have had variations in their story so that you have a full range
Sure.
of something to present.
Yeah. So there's a common thread, but then there are unique features to the stories to be told.
Mm-hmm. Mm-hmm.
All right. Well, I have one more question for you. I'll invite the audience to put other questions in the chat if you have them. What are maybe 2 or 3 really, really useful techniques that you've seen other people use, other storytellers, where they did something and you went, oh, I should do that?
Let's see. Wow. Well, I don't know if I'm going to try to do this. You make me think about when a particular group, a medical group, reached out to me and they said, we're looking for someone to share their story. And all I could do is go back and think about a number of women who were part of the Go Red team that I was on, how much more compelling I thought their stories were. Again, I do have a friend who died, who went into cardiac arrest and was revived. Okay. I do have a friend who was doing a Zumba presentation and went into cardiac arrest and, has a really unique story to her being saved. Um, I don't see a lot of people that were part of that group still out sharing their stories, which always still makes me scratch my head because their stories are so powerful. And I think that they bring a lot of people are always looking for something, I don't want to say tragic, but it draws people
Dramatic?
in. Yeah, dramatic. There you go. When people hear dramatic stories, they are drawn in. And I did question for a while, why am I still out here doing this? Like, why do I still feel this real need and urge to do it? Because a lot of them went on to do other things and they're not out sharing like I'm still doing. But then I realized that the difference was just the passion and the fire that I have for this. So I don't know how to answer that question because I can't really think of um, someone that I've heard share their story, and it's like, that it drew me in. But I do know there are many people who have really compelling stories that I appreciate and respect, and I feel like I'd like to see them do more of that. I'd like to see them be a part of something like this because again, we're better together. The more, the merrier. We can get more done. We can make a bigger impact.
Wonderful. So Shelby's got a question. Shelby says, on the flip side, what are some impactful examples of how you've seen patients invited in to be storytellers and made to feel more empowered? So from the people or the groups that are asking for the stories to be told, what are some of the most impactful ways that they do that? Whether it's the way that they approach or they're working a network or it's the specific request that's being made.
I would have to say in 2019, when I was invited to be one of the Go Red for Women on the national team, that was a team of us. There were probably 8 of us. And each one of these women are from various states. And each one of these women would go out and be invited to serve in various capacities within their state or region. I got a chance to do a lot of radio and television and magazine stuff. Some of them went on to be on Good Morning America and the Today Show and a much bigger, broader audience. I guess I have to believe that they all felt just as compassionate about advocacy as I did. That's why they were part of this national team. But I think sometimes there are great groups in various states that will back something like that or sponsor someone to tell more of their story or create these amazing there are foundations that will have them come and do big events. I haven't had a chance to do that kind of thing here, but I actually go to Florida quite a bit, as you probably remember, and I've actually been asked by the Florida team to come and do things, because they know that I'm very passionate about it. And there are some really amazing groups out there in various states that are making a broad impact. And they are, I guess, filtering in and finding people in their communities that are willing to speak up and tell their story. I don't
Great.
see a lot of people here doing it though. And that's
So it sounds like if they know who you are, there's a specific ask, right? We're interested because we know that you have a story to tell. Sounds like name recognition might be helpful, where if you've heard of them before, that's a starting point. And if they've worked with folks before. I imagine, and this will be the last question because we're reaching the top of the hour. I imagine you've said no at some point to a request, and I'm curious if you can reflect on one of the times that you said no and what made you go, no thanks.
Well, I have to tell you, let's see here. I'm not good with that word, and that's why I've had people send, I have a box of these because I don't say no very well.
It takes one to know one. I suffer that too.
But I will say the only time I've said no was when I had to make a decision on which one of those particular events was going to be the one. Because sometimes it would be several in a day.
Sure.
So I don't know, I'm probably not good at answering that particular question, but yeah, where do I think that this is going to make the greatest impact, or the people that this group, I need to be there with this group because I just see them doing some great things, and I hope that me coming in and being able to share with them is going to help them to move to the next level or whatever.
Wonderful. All right. Well, with that, I'll draw us to a close. Thank you so much for sharing your time and your wisdom over these last 2 sessions. And we hope that the folks that have joined us have learned, and feel free to reach out if you're part of the Improved Network. We're happy to connect you with Ms. Debora. We're happy to talk more about storytelling, and we hope you all have a great rest of the day and weekend. Thank you.
Thank you, everyone. I appreciate you all.